point, I'm gonna tell you only the things that you need to know. So if you listen to only the things that I say, you will ace the exam. Okay. You're welcome. Albuterol. So I'm just starting, you literally just listen to exactly what I say. It is used for wheezing, for asthma. And it is an inhalation drug. And you have to monitor tachycardia. Did you get those three things? Okay, moving on. Wheezing, it's used for wheezing related to asthma, monitor for tachycardia, and it's an inhalation drug. Alprazolam. It may cause drowsiness, but that's a normal side effect. It's used for panic disorder. And that's all you need to know. Huh?
It may cause drowsiness. That's normal.
Yes, it may cause drowsiness, that's a normal side effect, and it is used for panic disorder. Cogentin, just know the class, benzotrope. Aricept, just know that it's used for Alzheimer's. Okay? Oh, and here's another thing to tell you, let me tell you. I realize that we have the generic and the brand name, but the test and all tests in the future in NCLEX and in class will only have the generic name. So, knowing the brand name does you no good. So. Just know the Cogentin and Aricept, just know the class. That's okay. The one in parentheses is the brand name. You need to know the one not in parentheses, the generic. The reason is because NCLEX is taken in the States and in Canada, so that's why they only do generic. Okay, hydrochlorothiazide. Know that it can cause severe hypokalemia, severe low potassium, so you have to monitor the potassium because it's a diuretic. So it's a diuretic that it's not like this. I'm just saying words, but I said the important part slowly and quickly, precisely. But you have to monitor the potassium because it's a diuretic that is not potassium sparing like aldactone. Okay, so hydrochlorothiazide, monitor the potassium. Hydrocodone/acetaminophen. It's used for moderate pain, such as a 4 out of 10. And it can cause respiratory depression. So you have to monitor for that. Okay, moving to the next one. I'm sorry, I keep forgetting to move my little thing in the G. Okay, hydromorphone. It's used for severe pain. I always use morphine as my intermediary to determine hydromorphine, just so you know, or Dilaudid is 10 times stronger than morphine. But what I just said a minute ago, what you have to know. Okay, insulin. You administer it abdominally and in the anterior thigh, but not in the deltoid. You do it in this little part here, people, but not here. This is the deltoid. This is not the deltoid, okay? This is the deltoid. Don't answer deltoid. This is where you put it if you wanted to do sub-Q, right? But it has to be sub-Q, so the abdomen or anterior, which way? What is it? Anterior?
This is right.
Anterior is the front. I just know it's anterior thigh and abdomen. I'm telling you. Telling you. Not the deltoid. Okay. Okay, insulin. You need to know regular insulin is 30 to 60 minutes for your onset. And remember the thing about for onset for Glargine, it's a long acting, so there's no onset time. I mean, there's no peak, there's no peak for Glargine. It's Lantus. That's, I'm sorry, I'm not there, that page. The long duration insulin Glargine, whatever, I'm sorry, it's Lantus. I just know when I see that word is Lantus and there's no peak, okay? Okay. Lisinopril. Okay. The biggest, baddest side effect, or the most annoying / side effect, is the dry, non-productive cough for lisinopril. Okay? If that happens, then you need to further assess the client and possibly inform the doctor, the HCP, the healthcare provider. Okay? Pril, non-productive cough. Okay. Lithium. Okay. When it's really low, the low is below 1.5, right? So if that level, you have to use, it can cause electrolyte imbalances, okay? It can cause death if it gets really low, but just remember, use caution if you're taking lithium with the diuretic because it can cause electrolyte imbalances. It's that middle section. Use caution with diuretic electrolyte imbalances, okay? And super high levels, I'm sorry, did I say that wrong? Okay, I said that wrong. Shit, sorry, people. I put my arrow in the wrong way. I can't do the Pac-Man version, you know, like, so I do the arrows because I can never remember. Something like the alligator eats the big thing, but that just doesn't make sense to me. It still doesn't make sense to me. Whatever, I don't know. So I use up and down arrows, and then I had it wrong. Okay, so in really high levels of lithium, you can have cardiac dysrhythmia. And if for some reason you're not your friends, don't worry, just tell your friends exactly what I'm saying. So Ativan, just know the class. Okay, so Lovenox or low molecular weight heparin, or it's really enoxaparin is the, I thought enoxaparin was the generic name, I don't know. I'm pretty sure it is, but anyway. Okay, I don't know why it's in a parenthesis, but okay. You give it sub-Q, and it can cause, the really bad side effect is bleeding. And the antidote is protamine sulfate. Okay? Okay, Flagyl, or, I don't know how to say it. Thank you very much. I see the word, I'm like, oh, that's Flagyl. So anyways, it's used to treat C. difficile. It's in the second little bullet. No, it's not, because we're on the wrong page. It's in the second little bullet right here. Okay, this is important. Well, both of those things are important. It's given slowly over 1 hour. And it can cause GI upset. Okay. Metoprolol. The big thing for this is orthostatic hypotension. So, you know, what do you do? How do you care for someone that you worry about orthostatic hypotension? Get them up slowly, those kinds of things. So think orthostatic hypotension. The other thing to know is there's rebound cardiac excitation following abrupt withdrawal. So wean it off slowly. And then the third thing to know is the priority is check the heart rate and check the blood pressure and hold the medicine if it's below those parameters. Okay.
The parameter for 90 over 60 and 60.
Yeah, it's kind of like, almost like DEDGE for the heart rate, you know. I mean, 60 and 100 is your range of heart rate, so if it's below, you know. Okay. Morphine. It can cause respiratory depression. It can cause constipation, so you need to maybe put them on a prophylactic stool softener. And it can also cause orthostatic hypotension. You might see postural hypotension. It's the same freaking thing. It's like the new version of orthostatic hypotension. Okay, nifedipine. This probably is funny, but again, orthostatic hypotension with nifedipine. So you have to make sure that the heart rate is above 60, and you have to make sure the blood pressure systolic is above 90. So the priority is to monitor the blood pressure and heart rate. Okay. Protonics. It is to treat GERD, used to treat GERD, or pantoprazole. Okay, there's two other things. You have a higher risk of pneumonia because the gastric pH is not low, okay? So you have a higher chance of getting pneumonia. And then because of the acid, the gastric acid is not very acidic, you have a much higher risk of osteoporosis, so you have to make sure that they have calcium in their diet if they're taking it long term. Okay. Paroxetine capsules. Okay, so there's a side effect is dizziness. It's indicated for major depressive disorder, obsessive compulsive disorder, and PTSD. I'm trying to look at people's writing when there's not writing. Okay. Prednisone. It suppresses the immune system. Monitor patients for signs and symptoms of fluid retention. Monitor for signs and symptoms of infection and notify the doctor if needed. Quintippine. It's Seroquel. I don't know how to say it. Okay.
Put it in the Bible.
I'm like, I don't know.
We don't use the trade name, we don't have to do it.
Well, yeah, see, yeah.
Quetiapine.
Okay, it's for manic and depressive episodes in bipolar patients. And an adverse effect is lightheadedness. Risperidone, it's another class. Simvastatin, rhabdomyolysis. Rhabdomyolysis, muscle degradation, muscle destroying of muscles. Can cause muscle pain, weakness. If you see that, that's the adverse, you have, if that is occurring, they have to stop the medicine. So that's bad. You have to monitor their, it took me a while to, hey Kizzy, we were talking yesterday. LFT, liver function test. Monitor liver function test and make sure that the liver enzymes are not elevated. You should actually thank Kizzy because she notified me of the fact that you haven't had a discussion on this. So that's why I changed my plan for today and went over this. So everybody give,
Thank you.
yes.
Thank you.
So yes,
What did you say, make sure the liver what?
liver function enzymes, check, if they're elevated, that's bad.
I can give y'all my cash out.
Okay, valproic acid. It is used to treat major depressive disorder. And you have to regularly monitor the blood levels. It's down there at the bottom. Effexor, another class. And the last one is warfarin. You take it PO. The antidote is vitamin K. And it's contraindicated during pregnancy. And that's it. Just Effexor, another class.